So I just want to talk a little bit about some law and policy considerations. This is going to be very, very, very big picture. I am certain this came up in the implementation groups as you have to contend with your laws and policies and regulations, whenever you're implementing anything. So Corey couldn't be here today, but he works for a group called the Network for Public Health Law. In the Google Drive folder, there is a ton of resources that are put together by them. He runs a project for them called the Harm Reduction Legal Project. And their whole job is to provide advice, consultation to government agencies, nonprofits, community-based harm reduction agencies, healthcare providers around how they can provide harm reduction services to people who use substances. So if you do have a question about a law or regulation in your state, how to interpret it, whether it limits or what it limits or enables you to do in terms of your ED programming, he can provide some direct technical assistance around that, which can hopefully balance out the broadness of this. And then in terms of where I'm coming from, I am faculty at Brown. I am also the medical director for the drug overdose prevention program at the Rhode Island Department of Health, and I work for our New England SAMHSA Addiction Technology Transfer Center. So we're going to start with the forest and go over kind of like big law policy overview on like the federal level, state level, institutional level. I'm just going to talk very briefly about some law and policy resources, and then really in the breakout groups is where we're going to do a very deep dive, looking at the waiver for buprenorphine, ED methadone, and emergency department mandates, reporting, and patient privacy. So these are some things, so just to kind of, I'm going to give you some big buckets of like what's regulated at what level. So buprenorphine, EMTALA, health information sharing or like patient privacy, methadone, and naloxone prescribing, those are all generally federally regulated. There will also be some state and local things to contend with, but when you're thinking about implementing programs or providing these services to patients, these are the federal level of regulation to contend with. State regulated ED treatment requirements. So in Rhode Island, we have mandated types of treatment for patients with opioid use disorder who present with overdose. Massachusetts similarly has mandated treatment protocols. What Medicaid covers, do they reimburse for naloxone or peer recovery services? Are they a Medicaid expansion state? Those types of insurance coverage in terms of Medicaid. Naloxone distribution, this is more focused on pharmacy regulations. Can you provide naloxone directly to a patient to go home with? Can you prescribe to a third party? How is naloxone dispensed? Is there a standing order in your state? So can anyone go to any pharmacy and get it? There's a wide variety of naloxone laws, and I'll show you a legal resource you can use to look at laws in your state. Overdose reporting. Again, in Rhode Island, there's mandated reporting of all opioid overdoses. There's a lot of established protocols and systems for that. In terms of patient privacy, a lot of states do have mandated reporting. Paraphernalia laws, which would affect your ability to give out fentanyl test strips, drug consumption equipment. Those are also all different state by state, although all generally based off of one model law, but there's a lot of variability. And then prescription drug monitoring programs. Those are also all state regulated. There's going to be different things in them. Methadone's generally not. And Rhode Island added naloxone actually to our PDMP, although it's not a controlled substance. We have ICD-10 codes in our PDMP. Whether you can use the PDMP for research and evaluation of your programs, those are all kind of state level regulations. And then institutional policies, procedures, and protocols. Every hospital system is unique and special in its own way, but they do have a lot of things in common, but there's really in general like lots of local politics to navigate. So medication dispensing, hiring practices. We talked a little bit in the peer navigation implementation, behavioral counseling breakout group. Can you hire someone who has a past history of incarceration? What does that look like in your institution? And then protocol development implementation. This generally involves lots of conversations with risk management and legal, but there are, I think a lot of facilitators on the kind of local level to borrow from and model off of. So having a site champion, as previously mentioned, drawing from existing models and protocols. When I came in today, I saw Bill. I was like, oh, great, I'm so happy to see you. We looked at your ED methadone protocol, but can you come meet with us? And just drawing from lessons learned and from people who've done this in places where and have been successful and have gained a lot of insights and experience, and then support from partner organizations outside the healthcare system. In your hospital or institution, there are some key people you really need to engage. Risk management being a key one. Having risk management and legal review your policies and protocols go a very far away when you're going to implement them, and when you're going to go talk to your ED and hospital leadership. Because for example, when we were setting up ED naloxone, my department was like, I am not so sure about this, right? So, I went to pharmacy and therapeutics. After I'd already gone to risk and legal, because pharmacy and therapeutics, this was like in 2014, they're like, are we enabling drug use? Was like the main question and concern. It's like, we've reviewed this with risk and legal, we've reviewed the evidence, and like they are supportive of our protocol, and then you can like talk about why naloxone distribution does not encourage substance use. ED leadership is obviously very key to get on board, because if you are indeed implementing something in the emergency department. Pharmacy is super key. Our committee is called Pharmacy and Therapeutics. You might have a different name for that committee, but whoever kind of approves your medication or treatment protocols for your hospitals, that's very important. And then anyone whose realm of work touches this realm, you need to engage. Relationship building is really important. Trust is really important. There is a lot of turf situations you have to navigate. So social work, psychiatry, addiction medicine, we want everyone's expertise at the table. Everyone's valuable. You're not taking anybody's toys. These are shared toys. We can all do this together. I think is really important, just in terms of getting people on board with your program. Also, when I was starting to do a lot of the implementation, I was a resident and I didn't know anything. I still don't know anything, but I especially didn't know anything then, and it was a lot of like ping-ponging around of like, this person told me I have to do that, now this person told me I have to do this, now this person. Gauging people early will give you like a nice set of like who you need to talk to, what are the types of protocols and procedures your institution needs, so you can meet those needs accordingly. So 2 resources that are more helpful in terms of the federal and state level law policies and regulations. One is the Harm Reduction Legal Project, which Corey works for, as I already mentioned, and the other is PDAPS. So Harm Reduction Legal Project, they provide legal analysis, regulation and law interpretation and consultation, and they also provide strategic guidance. So these are some of the reports on their blog, on their website. This is their website. And I put some relevant ones in the resource folder, but they will talk to you about, like, can you give expired naloxone? Like, what are the emergency department mandates? What are the good SAEM laws? Protections do they actually provide? Can you give out naloxone from your emergency department? Different things like that. This PDAPS is kind of fun because you can you can see what different laws highlight in different states and what the text kind of looks like. So this is just one example about naloxone laws. So I don't know if you can read it, but it says, are prescriptions of naloxone authorized to third parties? So the blue states are all states where naloxone is authorized to be prescribed to a third party. Does everyone know what third party prescribing is? Basically means you can prescribe it to another person even if they tend to use it on another human. So I'm a mother, my child has opioid use disorder, I want naloxone, it's not for me, it's in case I come home and I find my son having had an overdose. And then I guess whatever color that is, green, mauve, whatever that is, they do not have those laws. And there's different laws that you can look at. You can look at paraphernalia laws. It's kind of a helpful thing to give you a general lay of the land of what they are. But you should always talk to a lawyer. This is not in place of having a lawyer. But in case you're in a state where you're I'm going to give out syringes, but it's a state that has a very strict paraphernalia law, that would be an example of a good time to get some lawyer expertise. So that's my like very large forest overview. There's a ton of expertise in this room, so I feel like I'm talking a little bit, some people who are highly knowledgeable, but I'm also very happy to take any questions. We do have some breakout groups, which I have listed here, where we're going to get more in depth about waiver, ED methadone, and then emergency department treatment mandates, reporting, and privacy. Yes?
So if you have a legal question, can you just query it from
Yes. You can just email them. Their like literal job is to answer your question, and it's free to you, so you don't pay them or anything like that. So yeah, you can email Corey at this cdavis@networkforphl.org, and they will look at whatever law, like look at your question and do like legal research and regulatory research on your question, and hopefully provide you an answer.